The Italian Association for Cancer Research recalls that there are no specific symptoms that unequivocally allow to recognize the onset of cancer. In most cases, they are caused by a certain pathology, which does not necessarily have to be serious or cancerous in nature. However, there are some alarm bells that should not be underestimated, and it is important to contact your doctor to rule out the presence of a malignant tumor. Early diagnosis improves the effectiveness of treatments and increases the chances of survival, as the tumor is in the early stages of its growth. Among the signals to be recognized, a distinction must be made between the general ones and those specific to individual organs. Let's see what the general ones are. Excessive and unjustified tiredness. Fatigue is a term used to describe a situation in which we feel a lack of strength and therefore a decline in psychophysical energies. It can be caused by excessive temperatures in summer that favor abundant sweating and therefore a significant loss of fluids and mineral salts that favor dehydration. It can be caused by excessive physical activity or the frenetic rhythms of daily life, but it can also be the alarm bell of a pathological condition. In this case, the feeling of tiredness and fatigue does not improve with rest or persists over time. One of the possible causes could be anemia, a pathological reduction of hemoglobin in the blood, that is the protein used to transport oxygen. Anemia can have many causes, but in some cases, it reveals the presence of leukemia, cancer of blood cells, especially white blood cell progenitor cells. Anemia could also indicate the presence of a solid tumor, which bleeding imperceptibly, but for a long time, causes a lack of iron stores in the body. Involuntary weight loss. Excess fat related to being overweight or obese can have important consequences for your health, and is generally caused by bad diet, poor physical activity, and an improper lifestyle. Lowering body fat can improve your health, increase life expectancy, and reduce the risk of cardiovascular disease, diabetes, and cancer. However, if you notice that you lose a lot of weight and it is not justified by a more restrictive diet or by a change in your lifestyle, it is good not to rule out that it is caused by a disease, not necessarily cancer. Some malignant tumors, such as ovarian cancer, when they get large enough start to press on the stomach, and this can make you feel full faster. Furthermore, cancer increases the inflammatory response and therefore the release of some pro-inflammatory cytokines that alter the functioning of the hormones that regulate appetite. In late-stage cancer, however, cancer cells require more energy than healthy cells, and so your body can burn more calories at rest than it normally would, thus causing you to lose weight. Fever. Fever is a sudden increase in body temperature above normal values, and is a temporary pathological state that involves an alteration of the hypothalamic thermoregulatory system. Once the infection is over, the fever disappears. If, on the other hand, it persists for several weeks or months or recurs frequently, it may indicate the response to particular infections that the body is unable to defeat. In the case of fever of neoplastic origin, the cause is the response of the immune system to some forms of cancer, especially lymphomas and leukemias. It is usually characterized by a sensation of heat and sweating, but presents with less chills than infection fever, and is less sensitive to paracetamol. Jaundice. It is a yellowish discoloration of the skin, mucous membranes and sclera, i.e. the whites of the eyes, due to an increase in bilirubin in the blood, a yellow-orange substance that forms after the degradation of aging red blood cells, which are destroyed by the spleen. Jaundice can be due to diseases of the liver and biliary tract, but in some cases it can be due to a tumor blocking the bile duct, impeding the normal outflow of bile. Abundant night sweats. Night sweats can be linked to some conditions, such as the typical hot flashes of women in menopause in case of thyroid problems, but it can also be caused by infections or by the use of some medicines. However, abundant night sweats may in some cases indicate the presence of particular forms of cancer, such as some types of lymphomas. One of these is Hodgkin's lymphoma, a cancer of the lymphatic system that originates from B lymphocytes, a type of white blood cell found in the lymphanoids, spleen, bone marrow, blood, and numerous other organs, and perform important functions in defending the body from agents external. Itch. Itching arises from some specialized nerve cells located just below the surface of the skin, and following a certain stimulus of various sizes and types, they transfer information to the central nervous system, and the need to scratch arises. A persistent and widespread itching over the entire surface of the body may be due to the onset of a malignant tumor, for example a lymphoma, a tumor that affects the lymphatic system. The motivation is not entirely clear, but doctors think the itch may be caused by the substances the body releases to fight cancer or by the cancer itself. We have therefore seen that behind every symptom there can be many causes, more or less serious. The advice is always to contact your doctor as soon as possible when you feel some alarm signals that our body sends us. Prevention is the best weapon to overcome cancer because it can be defeated if taken in time.